A question that we receive pretty frequently is what is laser gum treatment? What's the difference between that and traditional gum treatment? So we use lasers in periodontal therapy in place of using a scalpel. So in a traditional type of surgery, you'd have if you had gum disease and they were treating it with what we call flap surgery, they'd use a scalpel to make incisions and clean out the infection, and then that would all be sutured up at the end. With laser periodontal therapy, there's no scalpels. And so the big difference between this and that traditional type of treatment is with the flap surgery using a scalpel, you typically have some swelling, you have some gum recession after the surgery, and the recovery time is longer because the tissues have to be sutured together. With laser surgery, it's minimally invasive, and that's the big thing right there. The laser does make an incision in the gum, but the incision is 500 microns thick. A human hair is 100 microns thick. So it's a very thin, small type of incision. And it's called minimally invasive because we don't have to pull the tissue away from the teeth at all. I use high-powered loops, and I'll use a laser to vaporize the infection underneath the gums. And using the loops, I can see what I'm doing. And then depending on the amount of damage that the gum disease has done to your teeth and your gums, sometimes I'll just use the laser alone. And the normal healing process after just using the laser alone are the gums re-adhere to the surface of the teeth, and there's no recession associated with it. There's no swelling associated with it. Many times after surgery, patients can't tell if they've had surgery a day later. And so because there's no swelling, there's no pain. And so most patients don't need pain medication after this type of surgery. And another really big thing is you've probably met or had some relatives that had traditional gum surgery. And one, they tell you, well, it takes a couple of weeks to recover from, and two, your teeth get longer, and three, your teeth become sensitive. You can't eat ice cream or drink iced tea, that kind of thing. With a laser, it desensitizes the teeth. So you don't get the gum recession, you don't get swelling, you don't have pain, and you don't get sensitive teeth afterwards either. So having a minimally invasive procedure allows you to have treatment for your gum disease in such a way that you can't tell you've had treatment for it when it's all said and done, except that the infection's gone and your gums are healthy. A lot of general dentists will provide initial therapy. I've had lots of patients who have told me, well, I had a deep cleaning done, and a deep cleaning is a good initial therapy. It helps reduce the infection in your mouth. It doesn't typically clear it, but after a deep cleaning at a general dentist office, you'll typically see that the swelling and puffiness of the gums goes down. But the pockets tend to reoccur within months after having a treatment like that. So it's an initial treatment, but it doesn't truly resolve the problem. So seeing someone like me, especially someone who can do a laser type of approach, we can get you on a long-term program of making your teeth and your gums healthy and keeping them that way.